I think the thing that really struck me in our discussion was perhaps obvious to some, that we need to keep the patient's perspective at the center of all of our considerations in our discussion. Obviously, patients are our customers, and they're the reason that we provide this specialty care for people with inflammatory bowel disease. And particularly, I think there was emphasis on access to care as being a primary concern among our patients. And so I think we have to be creative on how we solve that problem. We don't have infinite resources to provide perhaps the access that people are thinking of in terms of seeing physicians on a regular basis, because there are a limited number of physicians available with this sort of specialty interest. But I think there are other technologies, other pathways through which we can help patients access the information that they want, access the advice they want, without perhaps falling in the traditional model of care, which is physical visits in physicians' offices. I think we really need to look at how we deliver care locally, regionally, and nationally. And it struck me again today that we need to be a little more strategic about how we, and I speak of we as working at academic centers where perhaps we provide complex care for patients with inflammatory bowel disease, but thinking a little more strategically about how we relate to our community gastroenterologists in more general practices, and how we relate to our primary care colleagues, and how we communicate back and forth, how we standardize our approaches, and how we make sure that each piece of that system of care is fulfilling an important purpose that is appropriate to their position in that stream of care. So I think we really need to go home and look locally at our networks, our relationships, our ecosystems, if you will, among advanced specialty care IBD centers, general gastroenterologists, our surgical colleagues, allied health personnel, including psychiatrists, for example, as well as primary care providers. And I think each of those providers offers a unique skill set, an important skill set. We need to be perhaps more strategic in how we leverage all of those services to provide a more comprehensive care for our patients.